Tranexamic acid. Controls heavy bleeding. BY clotting mechanism. Shows antifibrinolytic activity. Bicompetitively inhibits the activation of plasminogen to plasmin, a molecule responsible for the degradation of fibrin. Ethamsulate is a hemostatic. It works by increasing the ability of platelets to stick together and form blood clots. Help to stop bleeding during heavy menses. Pantop is a type of medicine called a proton pump inhibitor, PPI. Proton pumps are enzymes in the lining of your stomach that help it make acid to digest your food. Pantoprazole prevents proton pumps from working properly. This reduces the amount of acid the stomach makes. Ranitidine reduces the secretion of gastric acid by reversible binding to histamine, H2, receptors, which are found on gastric parietal cells. This process leads to the inhibition of histamine binding to this receptor, causing the reduction of gastric acid secretion. Phenyramine maleate is a potent antiallergic drug, commonly used for the treatment of rhinitis and allergic conditions. It has histamine 1, H1, receptor antagonist action. Dexamethasone is a corticosteroid. It works on the immune system to help relieve swelling, redness, itching, breathing problem, arthritis and allergic reactions. Dexamethasone is a potent glucocorticoid with very little if any, mineralocorticoid activity. It works by suppressing the migration of neutrophils and decreasing lymphocyte colony proliferation. Betamethasone is also used like same. Ondansetron blocks nausea and vomiting by 5-HT3 receptor antagonism at 2 specific sites, I, centrally, in the area postrema (ONTS), and 2, peripherally on vagus nerve terminals. Diclofenac exerts its action via inhibition of prostaglandin synthesis by inhibiting cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2. Used in stomach pain, full body pain. Furosemide promotes diuresis by blocking tubular reabsorption of sodium and chloride in the proximal and distal tubules, as well as in the thick ascending loop of Henle. Phenytoin is often described as a non-specific sodium channel blocker, and targets almost all voltage-gated sodium channel subtypes. More specifically, phenytoin prevents seizures by inhibiting the positive feedback loop that results in neuronal propagation of high-frequency action potentials. Use in epilepsy. Ceftriaxone. Ceftriaxone is a third-generation cephalosporin. It's a bactericidal agent that acts by inhibition of bacterial cell wall synthesis. Useful in typhoid fever, meningitis, lung infection, urine infection. Gentamicin antibiotic is bactericidal. Gentamicin passes through the gram-negative membrane in an oxygen-dependent active transport. As oxygen is required, this is why aminoglycosides are not effective in anaerobic bacteria. Useful in heart infection, pneumonia, bone infection, genital infection. Amikacin, aminoglycoside antibiotics, binds to the 30S bacterial ribosome subunit, resulting in interference with a reading of the genetic code and inhibition of protein synthesis. Useful in pneumonia, intra-abdominal, bone infection, genital infection. Cefotaxime. Cefotaxime is a third-generation cephalosporin antibiotic. Useful in cellulitis, endometritis, lung infection. Penicillin plus tazobactam. Penicillin kills bacteria through binding of the beta-lactam ring to DD transpeptidase, inhibiting its cross-linking activity and preventing new cell wall formation. Useful in cellulitis, typhoid, jaundice, UTI, Lung infection. Amoxicillin competitively inhibit penicillin-binding proteins, leading to upregulation of autolytic enzymes and inhibition of cell wall synthesis. Useful in ear infection, mouth infection, jaundice, lung infection. Metronidazole is in a class of medications called nitroimidazole antimicrobials. Useful in stomach infection, loose motion, food poisoning.